Welcome to Season 2 of the Lion's Den podcast, where you'll find just men talking. Hopefully you enjoyed Season 1, where I feel we brought you some dynamic information. In Season 2, we hope to do the same. In Episode 1 of Season 2, I had the pleasure of sitting with Dr. Masters from Christiana Care. Dr. Masters is an oncologist who specializes in clinical trials. As I told you earlier, in one of my earlier podcasts during Season 1, that I was a member of a clinical trial. So we just kind of peel that back. Also, I was invited to sit in on their podcast. Christiana Care has a podcast called For the Love of Health. I sat on that podcast and we had some very candid and open discussions. We all have storms in our lives. And I just did some research on storms and just behaviors of storms. And most animals, when a storm comes, they run away from the storm. They try and outrun the storm. But the buffalo runs towards the storm. And what happens in doing that and running towards the storm head first, by the time they get to the other side, the storm has cleansed the air, cleansed the earth, they breathe better, the grass is greener, and they can partake of the newness of the day after the storm. So that resonated with me because I thought of it in terms of health. I believe when we have our diagnosis or we don't go to the doctor at all, that's us running with the storm. And anyone could tell you, you will never outrun a storm. A storm is going to continue and continue until it's run its course. But if we then take our lives as the bull and run towards the storm, then we look for greener pastures on the other side of that storm. So I ask you all to be like the bull. Run towards the storm. And brighter days are on the other side. Remember to like, share, and subscribe. I mentioned earlier that I sat in on a podcast with Christiana Care called For the Love of Health. You can find a link to that podcast in the description section of episode 1. Thank you. Welcome to the Lion's Den, a place that you'll just find men talking. Today I have with me Dr. Masters of Christiana Care. Dr. Masters, would you introduce yourself, please?
Thanks, Robert. Hi, I'm Dr. Gregory Masters, and I'm a medical oncologist at Christiana Care. And I also serve as the principal investigator of the Clinical Trials Research Program at the Cancer Center. That's the National Cancer Institute NCORE program, which stands for the National Cancer Institute Clinical Community Oncology Research Program.
Okay. Wow. Mouthful. So what is the process from idea to clinical trial?
Yeah. You could also just say I take care of cancer patients.
Yeah.
You know,
that wouldn't be as robust.
Yeah. So when someone, so we have a standard of treatments for different cancers, and that's come through years of research and experience. And we know that with many cancers, we don't have a perfect answer, that there's room to improve.
Yeah.
And so the room to improve can be gained by people participating in clinical trials where we keep very close track of how people are treated, assign them to different forms of treatments, and then we see what ends up working best. So someone may have an idea for a clinical trial, and then we get together in a group through centers all over the country. We get together in meetings a couple times a year, plus often we'll have conference calls every month. Someone will have an idea of how they think they might improve a particular type of cancer in a particular situation. And once they have an idea, that's put to paper, it's discussed among the group. It's really a group of experts throughout the country that have been involved in clinical research and cancer care. And we decide what's the best way to try and answer a question to make things better for a group of patients. So then once that document is on paper, it has to go through a series of processes. First, through a group that looks at it and decides, is that the right question? And then, is that the right way to ask that question? And then, are patients going to like this clinical trial and be willing to participate in it? And then it has to go through a vetting process through the National Cancer Institute, where it's reviewed by other committees. And then once it's gone through that process, it has to go through an institutional review board that says, yes, this is an appropriate trial to conduct in patients with cancer, and we think it asks a fair question and it can be done safely. And then that's all put to paper, and we write up a form that outlines for a particular patient what's called a consent form, and they can read through that, see the process that occurs for that study, see if they want to be part of that study, and if they go through that consent process and it's right for them, then they're enrolled in the clinical trial.
Oh, that sounds really good. Now, today I'm sitting at Christiana Care with Dr. Masters, and where we took part in a podcast earlier called For Your Health, For the Love of Health. And as I told you guys before, that I was a part of a clinical trial too, and what he just explained is pretty much, the feeling I got throughout it. They were very hands-on, and, they helped me through, and even some of my concerns, most of my concerns, or all of my concerns were taken care of. They made me feel very comfortable and safe.
I'm glad you felt good with it, because that's really an important part of the process is not only that we ask the right questions scientifically, but that we're taking care of patients and doing something that the patient considers valuable.
Yes. And at what stage of a trial do you determine if it's working? And at that point, would you then, move on to a more proven method?
Yeah. So when people participate in clinical trials, ahead of anyone enrolling in that study, it's reviewed by statisticians that tell us how many patients should participate in the study to try and find an important difference that will be meaningful for patients. So if we're going to introduce a new therapy that may be more expensive or may put someone through some additional side effects, we want to make sure that it has a significant benefit for patients. And statistically, you have to go through a process of seeing how many patients do you need to find a certain percent advantage for some clinical trial. Many trials, let's say it's a trial that involves hundreds of patients. So you want to make sure as you go along that you're going in the right direction. So there's groups through the National Cancer Institute that also meet and look at the preliminary data before it's published for the community. And they say, is this going in the right direction? Meaning, is there a good chance that it's going to help more than it's going to hurt?
Yes.
If it looks like it's on the right track, the trial will continue until the full number of patients is enrolled, or what we sometimes term accrued to the study. If it looks like it's not helping people, or if it's causing too many side effects, then someone can step in and say, wait, we don't want to keep going and have more people go into this trial if it's not helping. And then a trial would be stopped early. We would tell patients that this isn't the best way to treat you. And then we'd look at what the next options for therapy might be. And it might be a different form of radiation. It might be a different type of chemotherapy. It might be other medications. It might be other ways to support you through side effects. And we're constantly, as physicians, we're constantly sort of evaluating a patient and saying, is this still the right thing to do for this patient?
Good answer. Yep. So what is the success rate of the trials that you've administered?
Yeah, so we've been part of thousands of trials over the last 20 years through this NCI NCORE program. And some studies don't prove to be better than a standard treatment, but many studies will show that there's an advantage to, let's say, a new form of radiation or a new schedule of radiation or a new chemotherapy drug. And if we find that, then we can take that to the community and make that available to thousands of patients, nationwide and worldwide, because those results are then published, they're discussed, and they're reviewed so that everyone throughout the country can have access to the best new therapies that the clinical trials show.
Okay. Okay. There's a stigma in the Black community regarding clinical trials. What steps are being taken to change that perception?
Yeah. And that's a critical question, because we try and make sure that we understand people's individual characteristics and their individual concerns and unique people from maybe a particular community like the Black community, but maybe also just from a rural community, other people who have different priorities. They may have different priorities than the doctors and nurses.
Right.
So we try and ask ourselves and include people from all different backgrounds. How are these therapies going to affect people? What are the concerns and the risks going into that? And how can we help them understand that we are trying to include everyone and come up with a therapy that's not just good for someone who looks like me, but also who looks like you or someone else? We need help with that. And so we try to get patients like you to speak about the clinical trials process and to explain a good experience if you have it. And if someone has an experience that's not as good, we want to hear about that too.
Exactly.
And say, how can we make that better for you and your family and your community?
Yeah, because if you don't ask those questions, you'll never get the answers that you're looking for. You know,
Yeah.
it'll be, and the problem that occurred was, of course, the big one is that Tuskegee experiment.
Yeah.
And I think it ended in like maybe 72. You know, it's been some years, but people are still carrying that baggage.
Yeah.
And for me, I went through the clinical trial. It was great for me. I was talking maybe 2-3 months ago to an actual nurse. We were at my granddaughter plays volleyball, and we had a volleyball practice. And I was telling her about my experience, and I told her about the clinical trial. And she said, well, what's the name of the trial? I didn't know the name, but I knew what it was about. She said, oh, they could be in there, you know, doing the Tuskegee experiment on you. I said, well, no, it's not that. You know, she was joking about it, but it's not a joke.
No, it's not a joke. And I think we as clinical researchers and as clinicians have to recognize when we've made bad decisions. Even if it wasn't, you know, me personally, we have to recognize that there have been injustices, there have been, you know, trials and treatments that weren't appropriate and weren't fair. And, you know, I think we have to recognize that and get everyone's viewpoints on how we can make that better and how we can make you and everyone comfortable with the process. Because even though it is a big step forward to be part of a clinical trial and it's taking a risk, it's going to help you and it's going to help people you know, and it's going to help our kids and our families and our communities.
Absolutely.
Yeah.
Yeah, and that's what's important, you know, giving back, helping someone else.
Yeah.
You know, so what would you say to those people that are skeptics about clinical trials?
Well, and there is a lot of skepticism out there now, that's for sure. And some of it is justified, like you said, about the Tuskegee experiments and, you know, not treating people fairly or not treating people justly or not treating people equally. And we have to overcome that, and we have to do a better job at that.
Right.
But I also would say that the only way we're going to do better at treating me and you and all of our families is to continue to pursue the best treatments through good scientific research. And good scientific research means that we're testing new theories. We're not just saying what I think or what you think, but we're actually trying them out and seeing, are they really better for people? And do they help the way you feel? And do they help you survive your cancer? And we need to make sure we're communicating that this is an all-in-one together process where we're trying to get everyone's opinion and help everyone. And I think that's the way we move forward, because if we don't, then we're left, you know, with what one person's opinion or some group's opinion is on the best thing without getting actual, you know, facts involved. And it's so important to do the science, to understand what's best for people and to explain why.
Yes, absolutely. That is great. And yeah, and for me, again, I think, and you touched on it when you said helping each other. And you know, I alone cannot do do it. But together, I think we can move it. And together with this conversation today, I believe that we're going to move a needle because I've gone through a clinical trial. You're a doctor that administered clinical trial. So, we're talking and hopefully getting the word out to people that would actually, take action. We all have to take action.
I agree with you. We have to work together, and that's the way we solve problems. And we're trying to show that that's the way we can do business together and help each other. And I think that moving forward, that's the way we're going to help the most people.
Yes. Today is a glorious day. Take a moment to breathe. I'm Renard. Peace.